Like summer in the weather department, and you may have also noticed all the bugs. We get a break during those winter months, but gnats, mosquitoes, ticks, they're making their seasonal comeback. Joining me in studio this morning is Tenille Miller, a nurse practitioner with Unity Point Clinic Family Medicine. Tenille, thank you so much for coming in today.
Thank you for having me.
Absolutely, really appreciate this because it's something that we just cannot stop talking about during the summer months. Many of us make plans to go hiking, to go camping, just spend a lot of time outside, and we forget, I think, because we have those winter months, oh yeah, we have to deal with all of those bugs.
Yes.
So we're gonna start with mosquitoes. I know, like, I'm one of those people that says, oh my gosh, they love me. Mosquitoes love me. I don't know what it is. There have been all kinds of studies, but peak times for mosquitoes roughly, and what would you say typically attracts them beyond the scientific standpoint?
Typically around like kind of wet areas. If it's rained, here comes the mosquitoes kind of thing. Well, but it hasn't really rained lately, but here comes still the mosquitoes this time of year. Evening time seems to be the prevalent time of the day, but then I've seen them midday as well in the morning. So kind of
like when you're watering your plants, right? All of a sudden there's just a million mosquitoes out there. They're like water, and they're after you. Again, like people say, don't put on perfumes or use, like, you know, fragrant soaps and things like that. So you're going to talk about some of the best methods to prevent mosquito bites.
Yeah, so if we use bug repellent that has DEET in it, there's different kinds of bug repellent forms. They come in sprays, lotions, there's natural remedies people may have. There's even some stickers. Stickers are great for kiddos.
Oh,
just plop them on there and they're good to go.
That's cute.
But then the higher DEET content or of the DEET chemicals in that spray, the longer lasting protection will have.
So that's what we're looking for, is that DEET and how much of it is in there. Now, if you're bitten by a mosquito and you notice an unusual reaction, how do you know if you should seek medical care?
So typically you'll have that initial reaction response of it'll be itchy, maybe some redness, maybe some swelling, depends on the person. Typically that should go down, but it's when we worry about it not going down and it gets much larger in redness, swelling is larger, hot, warm to the touch. The red, it starts to get red streaks going away from the bite. If it has any pus or drainage from the bite, definitely seek medical attention, especially if you develop a fever or chill with it too.
Absolutely. Okay, and then the best options for itch relief. That would be where I'm concerned. Get all the mosquito bites no matter what. So.
Yes, yeah. Well, first, don't scratch it. We always want to itch the scratch, but itching actually can make it worse. It increases your risk for infection, and then it actually delays the healing process. If we just wouldn't scratch it, it will go away much sooner, much faster. So meanwhile, while you're dealing with the itching, over-the-counter hydrocortisone cream is really good, along with calamine lotion, but you might not have that at home. So ice helps soothe itching. Honey has some soothing itching effects or properties. Aloe vera, onion has anti-inflammatory properties. Even toothpaste.
Yes, I have heard about the toothpaste before. Okay, and before we run out of time, we definitely want to talk about another pest that we want to be aware of. This can be very dangerous. We're talking about ticks. So what can people do to prevent ticks? Because they're kind of a sneaky one.
Yes, so anytime you're around highly wooded areas, timbers, places with tall grass or bushes, those are where you'll find ticks. So if you wear pants, long sleeves, a hat would be really good. Any exposed skin is free game. And then also the DEET repellent helps you prevent them.
Okay, and then when you have to remove a tick, I just took one off my dog last weekend. How do you do that when it's attached to your skin?
So we want to try to take tweezers and try to get to close to the skin as possible and just pull up slowly and gently, and trying to get all the tick contents, including the head that would be most likely stuck to the skin. And then you want to wash the area really good with soap and water, and then basically watch for any signs of infection. If you get the tick off before 24 hours, then you really decrease your risk of getting Lyme disease.
Okay, so something to check for on the kiddos and the dogs for sure before they head to bed at night or before they get in the bath. Lyme disease risk and symptoms, you are looking for, you know, illness after you maybe pull a tick off.
And surprisingly, usually anywhere between 3 and 30 days after you have the tick bite too.
Yeah.
It's not initially or right away.
Immediate.
Yep. The symptoms are kind of vague. It's fever, chills, body aches, joint pain that moves from joint to joint can be a sign, and then that classic bullseye shaped rash.
Absolutely. All right. Well, Tenille Miller, thank you so much. Great information today. Really appreciate it.